Thanks very much, and thanks for the invitation. I work for a company. We develop and supply a broad portfolio of products for vets, farmers, and feed manufacturers. This includes a significant investment and commitment to the alternatives to medically important antibiotics, and for transparency, we also do provide medically important antibiotics for therapy of disease in livestock. We indeed totally committed to responsible use. This includes the removal of any growth promotion use of medically important antibiotics in livestock. So that is included in that commitment, and we're very clear about that. If I may also add another anecdote in light of the fact you said it should be a fireside chat. My own son actually nearly died. He's a livestock training. He was training to be a livestock veterinarian, a lot of contact with livestock, and he nearly died of a multiple drug-resistant Clostridium difficile infection, rather, in an Athens hospital 3 years ago. So I do know and feel that, and I also have a real love for livestock farming. A couple of points. I think it's been made very well. It's all about disease control, which is all about biosecurity, which is doable but difficult and requires really extensive consultation, coordination of the multiple stakeholders at the national level, at the local level. And it is doable and it is difficult. Building fences around farms which do not allow entry by either animals or people, controlling access of vehicles, standard operating procedures. This is all very, very important. Can be done, and we've seen it done in this area as well, but it and requires effort and commitment. Secondly, I'd like to reinforce what you said, Dan, is the importance of veterinary, paraveterinary, farmer awareness training to help everybody understand how to use a medically important antibiotic, but it should not be routine. Okay? It should not be for productivity reasons, but should be in response to a pathogen that is highly likely to be there, or is there. Again, that requires real effort at the national level, requires political will, stakeholder alignment, and investment. So that training that leads to responsible use is so important. And you've said, Dan, there are just not enough veterinarians, and the training processes are not simple enough and understandable enough. So absolutely right. If I may also just use another kind of, try to address the balance of One Health. And my next point, I may get heavily criticized for, but I just want to emphasize that it is not to reduce the focus on responsible use, because we must reduce AMR both in animals, for the sake of the animals and farmers, and in humans. But I would like to quote the UK 5-year plan on antimicrobial resistance, which was developed by the Ministry of Health and DEFRA in the UK. And there's a statement in there which says, increasing scientific evidence suggests that the clinical issues with antimicrobial resistance that we face in human medicine are primarily the result of antibiotic use in people, rather than the use of antibiotics in animals. So I think we need to recognize that the risk is likely often to be low and is often not known. Okay? The second point, and I'm sure you'd all agree, Bangkok here is a city of 8 million people. We've seen this. If you give every person 1 egg a week, that means you need 8 million eggs a week. 1 chicken lays 6 eggs approximately per week. So just for Bangkok, you need 6 million chickens. Okay, and you can't keep that in the backyard. So, and you have to farm large numbers of animals to supply just a moderate amount of protein. And it is broadly accepted that an egg in the morning and half a glass of milk contributes to a balanced and healthy diet, particularly for children, for sick people, and for geriatric people. So I think we all understand that. Sorry, couldn't get my printer to work this morning. We all understand that. And Dan, if I may say one word I find slightly disturbing in this context is the idea of increasing wealth of households. I think the truth of the matter is that I'm speaking with all the authority of somebody to whom this doesn't apply, that there are many millions of people in lower and middle income countries who spend practically all their disposable income on food. This is not a matter of wealth, right? And I think that for them to have available to them fish, eggs, milk, and meat that is affordable and safe confers very, very significant benefits, particularly for people with very little disposable income, which is not the case, I'm sure, for most of us in this room. I would therefore suggest that this area is not the place for arbitrary and precautionary bans, which has been mentioned by both Juan and by here already, but it is rather the place for an evidence-based approach that considers risk assessment and leads to improvement. My last little anecdote and then a suggestion. I am a veterinarian. I've been seen an environment where there's been an arbitrary ban on the use of antibiotics for the prevention of disease in feed. There's a disease in pigs called swine dysentery, caused by Brachyspira hypodysenteriae. This is a really complicated, difficult organism, which a vaccine cannot be produced for because it's so antigenically diverse. It's also very difficult to clean out of environments. So my experience was that feed administration of a medically important antibiotic was banned. The consequence was that the farmer had to jump into the pen and inject essentially wild animals that were bigger than him with a needle. He had to inject them with antibiotics, all of them. Okay? This was both stressful for the animals, dangerous for the farmer, and resulted in the use of critically important antibiotics, so unintended consequence. So therefore, what I recommend is, especially from those with great deal of expertise in this area, OIE, FAO, Codex Alimentarius, extremely good principles, is clear communication and help to local policymakers, along with local consultation, including the private sector who actually do the job of farming, such as policies emerge that are evidence-based, lead to improvement and a reduction in the use of critically important antibiotics.